And we are live. Hello, everyone. My name is Hetal Doshi. I am an organizational psychologist. And really, the reason why we're here today is because post COVID 19 and MCO specifically, we decided that we support the community with initiatives that could support the mental well being of at least some of us out there who might be going through some kind of struggle. And so we launched a Facebook group called Mental Health at Work. Today is our first month anniversary. As part of some ongoing initiatives, we've decided to call on some amazing experts who can either give us some insights or some techniques or at least some kind of inspiration. Apart from experts, we've also called some everyday heroes just like you and I. We've even had magicians on the show before and parkour experts on the show before. And so today I'm super, super, super excited because I have a guest that maybe about 3 months ago I chanced upon on this amazing thing called the World Wide Web. I was reading a couple of articles, and when I read those articles, I thought, wow, this must be a really, really super intelligent psychologist. And this must be somebody who really, really has thought a lot of things through. This is one of those deeper, well thought out kind of articles. And so that led me to this person's website called Relate Malaysia. And in that website, I chanced upon a lot more articles, super well thought out, extremely data oriented, with a lot of good facts. And I highly encourage you to go on their website if you can and like to be truly educated. And that also then led me to Dr. Chua. So that was 3 months ago, and I just thought to myself, it would be amazing to connect with somebody like her. Then kind of left it out of my mind. And then about a week ago, we ended up being on the same webinar, completely out of chance, completely in the space of luck. And then proceeded on to ask her if she would come on this show. And even though she's been super duper busy, we have her here today. So whoever is listening in or whoever chances upon this later, I can guarantee you that you're going to listen to some really valuable insights. A little bit about Dr. Chua. She is based out of Singapore. She's an experienced clinical psychologist. And she's, as I mentioned, she's founded Relate Malaysia, which is a not-for-profit organization. She's obviously got to have a super huge heart to be doing not-for-profit in the space of mental health, which is one of the toughest things to be doing. So without a further ado, Dr. Chua, thank you so much for being here. Who are you? Tell us a little bit about yourself.
Thank you for having me. Who am I? Such a big question. It seems so existential.
Yeah.
Local girl from Damansara Jaya, born and raised in the DJ, went to SMDJ, represent. And then I studied overseas, and I wanted to be a clinical psychologist since I was 15, and I pursued that dream. This is more than I'm going to be aging myself. More than about 22 years later, here we are. Yeah, clinical psychologist, and trying to do something good in the world, I guess. Yeah, my little part to change something.
Yeah. Oh, that's amazing. So I thought I would just get right into it and ask you, why are we not, as human beings, capable of looking after our own inner world? So much so that, as of 2017, I think the rate of mental health related issues had gone up to about 30%. And obviously under MCO, I'm sure it's even higher than that. Why are we not able to look after our own inner world, and why do we need professional help for it? I'm not propagating that people should go for mental health related services, but why is it that we're not equipped for this?
I would. I think we all benefit from talking to a psychologist, and I wouldn't say that we're not good at taking, sort of looking inward, but we are actually limited in how much we can introspect, because we're really, I think looking inward is like studying yourself, and it's much easier. I don't know whether you've experienced this. You can always figure out your friend's problems, right? So your friend might tell you and come and say, like, I just don't know why I always have problems with my boyfriend. And you can see it. You're like, I know why. You don't want to say it, but you know. And you're like, how can that person maybe be so blind to the issues? And it's just that, sometimes we have blinders on, and sometimes we just don't realize things. We know what we are able to know. But the outside perspective sometimes is more objective, is more helpful. They're able to integrate things from different parts of your story better, that we're all just naturally limited in seeing, because studying ourselves is not easy. So I think just on that fundamental level, on how much introspection we can do is somewhat limited. Are we good at then? Can we take care of our mental health? Yes, I think we can, given the tools. And but can we take care of our mental health alone without the support of others? It doesn't have to be professional, but then I'll say no, because fundamentally we're humans, we're creatures that need, maybe not always want, but need good relationships.
Right. I like that you say that. It reminds me of the time when I was, a teenager, and everyone was dating somebody, and you could just tell when your friends were dating the wrong person. And then and there's no chance that you would on your own say that I'm doing the wrong thing over here, but you can easily
Right.
see that in other
Yeah.
people. What are the typical ways that we end up getting into a space that just becomes impossible for us to then begin to cope? So how does this process take place, from a time where we are able to cope as human beings to the point that we're not able to cope anymore? What
Oh
happens
boy.
in that space? How do we get to that? It's like,
How do we
we're,
get
we're
that?
nice and
Oh,
we're nice and slim, and
yeah.
then suddenly we're like, boom, my God, how did I get obese?
It-
So I know
it's
it's tough.
yeah, yeah. it's
How
it's
does
a
it
it's a
happen?
big question.
Yeah.
So I'll say, like, obviously, the state of your mental health at any one point in time is the combination of many factors. So there's not just one thing. And some of us, it could be biological, it could be personality. Some people are just more prone to feeling negative emotions like anxiety, and that certainly contributes to that. What we do know, at least, so that's just kind of by no fault of your own, and not any choice. But we also know that your environment plays a big role. Again, not necessarily your own fault. I mean, as a child, you don't choose your parents, and so all those early experiences,
Mm,
negative or positive, contributes to the way you learn how to cope. So if you as experience a lot of trauma or a lot of difficult situations in
mm,
childhood, that doesn't help you develop healthy coping styles, because as a child, the pain is actually too much, it's overwhelming. So the way we
mm,
learn how to cope is usually by pushing it away, by suppressing
mm,
it, by saying it, okay, I'm just not going to deal with it. And it helped you to a certain extent as a child, but that way of dealing with negative things in life will catch up with you, in that the bad feelings and the pain and the hurt and the anger doesn't go away. And so
mm,
it's like filling your cup, as an adult, because you're not processing it and not learning how to
mm,
deal with it. It just, your cup overfloweth, and that's
mm,
probably when you start to experience more and more distress that you can't ignore.
mm. That's really, really very well said. Do you also take on
Oh, I think you got muted. It's okay. Hello, Facebook, whoever's watching.
Okay, this must
Oh,
be this is better, right? Sorry.
yeah,
Yeah.
no
Okay.
problem.
So I know that you are a lecturer and you're teaching in NIE in Singapore. Do you also take on clients?
Yes, yes.
You do.
I see. Yeah, I see. Limited number, so just
Yeah.
like a couple of clients a week. Yeah.
Right. Okay. That's good enough. That's a good sample size. Good enough a sample size. Or what are the maybe three insights that you have into what contributes as the biggest reason why people tend to need to seek help? So, what are the biggest contributors? You're talking about biological stuff, it could be childhood experiences, it could be personality. But what, in your opinion, tends to be the one thing that, or two things that typically create these kind of issues for us in our lives?
Well, I'll say
So, the
like
mood.
what the most maybe the more common things that people come to see as the presenting issues that they have.
Mhm.
People don't like to see psychologists or counselors or therapists generally. But let me just pitch how awesome it is. It's like for 50 minutes, you have someone pay complete attention to you, and not just like some random person who's bored, like but someone with the expertise and knowledge and with really positive regard and for you trying to understand you and help you through. And there's really no better feeling um, than that actually. It's difficult because that person, the psychologist, will direct you to what's hurting, and what's hurting is often what brought you to see a psychologist. So people will come in usually because life as they want it to be isn't going
Mm.
their way. So it's just their goals are thwarted, they're failing in school, their relationships are broken, they can't get out of bed. So depressive and anxiety symptoms are usually what we see most often. But
Oh.
people delay it. You know, the average treatment
Mm.
gap, the average treatment gap is about 80%. So 80% of people who need help don't seek help, and most people wait anywhere between 2 to 4 years to actually get
Right.
help.
Wow, I think that's a really powerful and super simple way of saying it. Like, the reason why you get into a stuck is because life just doesn't seem to be going the way that you wanted it to be, or that you want it to be going. And you're probably experiencing a lot of pain in that scenario. How do you assess? How do you I know we weren't necessarily going to talk about techniques, but
Mhm.
what is the fastest way to understand the source of your pain? I know we don't have 50 minutes, and I will not be the guinea pig for the day, but
No, what's the fastest way of understanding
yeah.
pain? Man, I wouldn't trust any psychologist who gives you a fast way to understand pain,
That's a smart.
primarily because because you all of us have great depth to us. What's most visible, if you fall down, I could say, well, you fell down and that's why you hurt. But there could be other factors contributing to the degree of pain you're feeling that really I don't know and you don't know yet. And I wouldn't know because I'm not a psychic. I can't read your mind and I can't
You
figure
can't.
you out. No, I know.
That's what science do, huh?
It's so sad. Yeah. But, it takes time. It takes time to understand you together. It's just like I'm there for the journey. I'm directing your attention to something. So I just feel like the role that we play is we're really ex- as a psychologist, you have the knowledge, the expertise, you educate yourself, and so you know how to guide people. But really what you do have is a flashlight, and so while we're just walking alongside you, a flashlight, and then we point it where you want to go, and something emerges there, we go check it out.
Wow, that's really quite profound, and I really love what you're saying about two things that I really love about what you've just said is number one, you wouldn't trust anyone who would be able to get you to the source of your pain super fast because there are many layers of depth. Um, And if you go too quickly and you assume that that's where it is, you're probably a little bit long, probably a bit
Yeah.
wrong, because obviously you've accumulated a lot of experiences in your lifetime. You won't be able to find it immediately. And the second thing that I really like is that it is a journey inwards. Like everybody calls it a journey inwards. And what you're saying is that you're taking a walk with that person, like a small little journey inwards. And
Yeah.
it's really nice
Yeah.
that there's a torchlight or a Sherpa
Who
kind of
wouldn't want to see me, right?
microphone.
Yeah, I know.
Sorry?
Who wouldn't want to see me after this? Yeah.
Everyone's like, oh my God, I want to go trekking with Dr. Chua after this. I want to see her torchlight.
I want to go traveling with a flashlight.
Yeah. Hopefully we can have Snickers
Explore.
as well, so we can have a little bit of nice bites along the way, huh? But I think that's the thing that a lot of people love nowadays. Like a lot of people, are embarking on treks and long, journeys where they go on their own, but in an external world. And I think what's important is also you take that journey into the inner world. What are the major issues that people come in with when they feel that like you said, things are not going right? Typically, they come in because what doesn't seem right? Is it their personal relationships? Is it work? Is it goals? Is it children? When do they typically come to you?
It varies, but I'll say relationships would be a common reason, and goals. Like you're failing at something, or you're not doing well at work. Yeah, something that you're experiencing is interfering with your goal progress. It could be panic attacks. It could be, and that's stopping you from working or studying. And so you want to come in to address that.
Right. And when you said relationships is one of the major reasons why people come in, is that correct? Or at least it presents itself as an issue with a relationship. Is that what you're
No,
trying to say?
yeah, it's more like we have conflict, and conflict brings us in because conflict causes us a lot of distress. Either maybe we're treated badly by someone, or we're treating someone else badly,
Right.
and we can't stop ourselves. That might also bring us in. Yeah, so it's
That's right.
often what brings us. I guess what brings people in is almost I think quite often people can see their behavior and see the way that they think, and it just doesn't feel right. And I think that's the best sort of sign for you. There's something doesn't feel right, and you may not even understand why you're doing it or what you're really doing. But as long as it's not quite right, it's good to
Mm.
just talk to someone to figure it out.
Yeah, absolutely. I think a lot of times people ask me, like, what are the presenting symptoms? What are the things that we need to look out for? And I'm like, don't get all technical about it. If it doesn't feel right, it's just not right. And that's the end of that. Like a stomach ache or your knees not working. The physical thing is that basically, if you feel there's something wrong physically, then you go to a doctor. Emotionally, if you feel there's something not right, and you just go check it out with the psych as well. So that's a nice, simple way of presenting it. When you say relationships, what are the typical relationships that you're talking about? Is it about partners? Is it about spouses? Is it about
Everything. I think
children?
any significant relationship in your life. Yeah.
Mm, right.
So
And obviously, as well, valuable to note that clinical psychologists don't dispense any medication at all. It is more
yeah,
CBTs.
those are medical doctors. Yeah.
Yeah.
Yeah. So we do something that is often referred to as talk therapy. We talk to you, and you might be thinking, "Well, how is that really going to work?" And sometimes it feels like magic. But talking is the entry point into, not to sound cliche, but it's the entrance to your soul, not your eyes. But your eyes can only reflect so much. But really, kind of just talking and exploring. And why I like psychology, always talk therapy, is that we're really looking for something that is more long term. So medication, we know, actually doesn't cure, right? It really helps you manage the symptoms, and I think it goes hand in hand with talk therapy. But talk therapy can work out the some of the long-standing issues in your life, and also help prepare you for the future and help deal with the problems of the present, whereas
Right.
medication cannot.
Right. And I know this is a bit of a silly question. You're probably going to say it depends as well, but how long does this process normally take? Like how many sessions does it
It
entail?
depends. It depends. I would, yeah, I definitely say it depends. And what I tell people though, I say, it depends on what you're looking for, but
Mm,
within, so the research would say weekly sessions. So again, out for anyone, don't um, see someone frequently. At least a week, on a weekly basis. Um, when the frequency between sessions are too long, it actually slows down your recovery exponentially. So do see your psychologist at least once a week at
right.
first. And then I would tell potential clients that within 12 sessions or 3 months, weekly sessions, you will feel a difference. So
Mm,
it's just a difference. It's not necessarily like you're not depressed anymore or you have no more issues. And
mm,
I say that because a lot of people come in with issues that can, as I mentioned before, we're just gathering things up as we go along. So if you've
yeah.
been behaving or thinking or feeling a certain way for 30 years, 12 sessions, I mean, what is it really going to do? So it's not going to change everything, but
Yeah.
within 12 sessions, you
Yeah.
will experience some kind of difference. And so that's all I can tell you. Yeah, you will
Yeah.
feel something has changed. And
Mm.
that's been true anecdotally, and the research would show that about 12 to 18 sessions, people do experience significant difference.
All right, that's awesome. And what would you say are three myths or three falsehoods that people have that they recognize by going through these sessions? So, what are three major realizations that people tend to have as they go on this nice long walk with Dr. Chua, with who's got a beautiful
With a flashlight. Yeah.
yeah.
Uh, well, I would say, I don't know where it's missed, but one common realization is the way we treat ourselves. We often find that the we're more forgiving of others for their mistakes than we are of ourselves. Unless you happen to be a very harsh, critical person, then in that case, you're just treating everyone harshly. But a lot of people tend to,
The cause of why
which,
everybody needs to go
yeah,
see psychologist.
that's also possible. That's a different issue, and that may be a problem. But in general, I think we are much more self-critical of
Mm,
ourselves. And when we are sad, for instance, we really don't tolerate it of ourselves. When we feel scared and we feel anxious, and so I think one of the uh, main things to learn in therapy is about the way we treat ourselves.
mm,
Are we compassionate? Are we kind?
mm,
Are we self-soothing when we're in distress?
mm.
The second thing is about how we treat others, and that's huge. So sometimes maybe we lack boundaries, right? We might end up doing too much for others, and then we get resentful. Sometimes we don't let anyone else in, and so we always feel alone in the world and detached. So I think the two main things that would cover most would cover a good number of people would be, you're going to learn about how you treat yourself and how you treat others,
Mm.
and then start to make changes so that you're actually going to be more content in your life and be able to find greater meaning in what you do.
And what makes you so skillful as to be able to do this? Because I'm sure you would have clinical psychologists, a whole bunch of them, but each one would be extremely skillful, and some would not be as skillful. What makes what makes for the gold standard of skills? Like, what would a
I
person?
wouldn't say what makes me skillful. I'm going to say, like, in general, what
Ah,
makes
yeah,
someone
yeah,
skillful.
yeah. Because I haven't tried you
I
out
still
yet.
have to be
I haven't
Asian,
tried you out.
I'm not
Yeah.
gonna I'm not gonna put myself out there. Yeah. So,
No, I haven't
uh,
tried you out. I can't say. But generally, what is the gold standard of skill set? What
mm,
makes a clinical psychologist really good? And the reason why I ask this is because, um, you know, if there's an issue with your heart, you might go to a cardiologist, but you would see three, and you would say that that one is better than the other one. Um,
yeah.
so the same thing with psychologists. You might go to a couple, and for those who
Yeah.
want to go meet one, how would you know that that's the one for you or that's super highly skilled?
Right. Yeah. So I would say for if you're looking for a psychologist, and it sometimes does take time. It's like finding the right life partner.
Oh, hopefully not that long.
All right, not that long, but it does take some time. Just as medication takes some time to work. The first thing to do is whether you feel comfortable with that person. Do you feel that that person understands your experience, and doesn't judge you? Not judge. I think the non-judgmentalness sometimes been interpreted as, I can't disagree with you. No, I can disagree with you. I might not want to do everything you did, but it doesn't mean I'm going to judge you, as I'm going to think you're a bad person. And
Mm,
I'm going to value you equally, whether or
mm,
not you did
mm,
whatever you did, or said whatever you
mm,
said, or thought whatever you thought. And so I think that's the first thing you're looking for, is someone to understand you, and who you feel is able to value you and prize you, and also knowledgeable in understanding the problem from a technical perspective and from a psychological perspective. Then really, from what I've seen, and I'm in the grand scheme of things, I'm not that old, and I feel like there's just so much to learn about people, right, and about how to help people better. So I feel like maybe I'm hopefully only quarter way through my journey, and I think that's essential in becoming more skilled. Is that you realize you really don't know a lot. You realize that the same limitations that all of us have in understanding ourselves, psychologists have as well. We're just trying to find it out. We're trying to fine tune and improve our understanding of people. And so continuous humility of realizing you really don't know. Because I think once you get to the point where you think you know a lot, you're going to make assumptions of people. And then you're going
mm.
to start listening to your clients, and the person who comes in, you're going like, oh, I know your story. And you're not going to be attending anymore. So humility, and then obviously a lot of classes and supervision. It's essential, I think. So it's a lifelong journey. So
Mm. Um, I think that's a really, really strong point that you've made over there. The fact that we hear so many stories all the time, and then
mm,
we may end up making some assumptions, and we may not end up tending to them, or
mhm.
just making a false prediction about what is going on. Have you ever
Yeah,
felt like you screwed up a little bit in a session or
obviously. I would
sorry?
like to say never, but obviously I have. Yeah. No, mistakes are the best way to learn. You just kind of hope that the mistakes you made um, aren't so bad. And it's the worst thing. Once you realize it, then the next time you just apologize. But yeah, I've said things, I've done things, and go like, ugh, that was awful. And you're not.
Yeah.
It's painful. Yeah.
Yeah, it is painful because
To be
it is our
incompetent.
profession. Sorry?
It's painful to be incompetent. Yeah.
Yeah, it's very painful to definitely be incompetent in the one space that you're supposed to be competent in, which is
Mhm.
being non-judgmental and not assuming
Yeah.
things, and then suddenly
Yeah.
you do, right? So that's a direct attack on how skillful you are as a psychologist.
Yeah, well, it's that, if I just point out, but that's also, I think, what is really important for the relationship between the therapist and the client, because you both realize that we're just two humans talking together. I'm not God, and I will make mistakes, and it just, as you come in with your stuff, I will come in with my stuff, and we're in many ways two broken people walking together. Just one has a flashlight, and so it's okay. We're working it out, and I think one of the reasons why I do enjoy therapy is because I feel like I'm changing along with my clients. My clients shape me. And shape me to be more aware of what I'm experiencing, or challenge certain thoughts I have or certain beliefs I have. So I become a better person because of them.
Yeah, you said it so well. I love the fact that it's two humans. Like, so please remember that the one holding the torchlight is also human. And I guess that's one of the things. I'm not sure about you, but generally, I mean, just being a psych in itself, I do get feedback once in a while from obviously people that I love, not clients and stuff. That you're a psych, you should know. And then you're like, dude, I'm a human being first, right? I'm a human being, but I mean, yeah, it's okay, it's fine. But I wanted to ask you as well, if you were the prime minister of a country and you know that the world is in a place where mental health related issues, and this is not necessarily a hypothetical question because the truth is that mental health related issues are increasing.
Oh, I thought it's not hypothetical that I'm a prime minister. I was like, yeah, I guess I
the
can.
hypothetical one is that
Am I launching my political career right now? Yeah.
I say why not? Right?
Yeah,
Like,
sure, why
absolutely,
not?
why not? What would you do if you're the prime minister, knowing of any country? I'm not saying a specific one, knowing that mental health related issues are increasing, but at the same time, we need to drive an economy. What is your take on this if you were the prime minister of a world?
I think driving the economy and addressing mental health issues go hand in hand, right? I mean, if everyone has poor mental health issues, like, we wouldn't have a good economy anyway. So I really think it's part and parcel about building a strong economy, a healthy society. So what would I do? I we're just talking about ideals here. And recognizing that none of these problems, I think, are there's no perfect solution, and I think it's sort of a balancing act in many ways. But one of the first things that I think needs to be addressed is that we need laws that protect the rights of people with mental health conditions at workplaces, so they're not discriminated against. Our labor laws don't cover that. I do think that, looking at the insurance plans that are offered, it's not enough. It's sort of people tell me to be positive. So I said, yeah, it's a good step forward, but it's not a great step forward. We could be doing better, and really the coverage is not great. And I understand, because insurance companies are not charities, and they are making money when they don't have to pay out money. But I don't want people to be kind of tricked into that, and people who are financially strapped go buy insurance plans that actually don't offer you good coverage. So I think we need a good national public health service that where we have well-trained people. And one of the things that I guess, experienced, or I've observed in my role as an educator, is that when the demand is up, our quality goes down. We're just trying so hard to push people in. And so I would like it to be known that bad counselors or bad psychologists have a tremendously destructive effect. It's as bad as having a bad doctor. It really can. You're talking to someone who's very vulnerable before you, and if we don't treat them well, we end up causing them greater pain, and more harm. So I think we really need to think about a long-term approach, not just in terms of quantity, but how are we going to ensure a good quality? What's our quality control like? How do we know that our counselors are even effective? And that's why when you sign up for Relate Malaysia, we give you a lot of questionnaires, which is tedious, but it's one of the ways that we can ensure like that even though we are trying to make our services accessible and low cost, we want really high quality, you know, really high quality but accessible services. And so I would say that that's not established yet. The way we are training our people and the way we're making sure we're offering effective services. So a couple of things there, I guess.
What would it take to get? What would it take for psychologists? And again, I'm not a clin psych or counseling psych. I don't do one-on-one, so this is not about me, and I'm not trying to push a specific agenda through. I just generally think that this is a very important thing from a community basis. What would it take for psychologists to get as much attention, or this field to get as much attention, and also be as well paid? I'm sure there are some who get paid extremely well, but the majority, they get paid like
Not so well.
not so well. Thanks for helping me to say that out loud. So what would it take? What do you think it would take? Like, what would you do as a first step to, like, kick this ball or get this ball rolling?
It's in some ways it's politics, right? The highest paid ones are always medical doctors, and so it's politics within the mental health system of who's the most valued, whose services are the most valued. It's about psychiatrists because the medical doctors are the most valued, and psychiatrists are like, but we train for really long. In case I offend any psychiatrists out there, I have many.
You have, I'm sure you have.
I bet it's.
So what you're trying to say?
It's just kind of funny. It's like, we trained for really long, and I was like, I trained for really long too, right? But you don't understand. I was like, look, we all play, in this ecosystem of mental health care, we're all playing important roles, and it's the same with any sort of health services, like nurses. Why are nurses so poorly paid? And it's the way we view and value people, and I just think that we're not even psychologists, but we're not valuing. We're only valuing sort of the top dog and we pay them sort of top dollars as if the rest don't really matter. And so, and psychologists are paid better than counselors, and I think counselors should be better paid as well.
Yeah. So okay. So you feel like this is a little bit of either a political thing, or maybe what I see as maybe a pattern that we are used to, maybe that we've never thought about
valuing.
Yeah.
It's all over the world, so it's not just Malaysia.
Yeah, that's true. So with that, I guess we've hit like almost a past half an hour mark. Actually, just before I get to the last question, I've always wondered during this MCO period, and this is the biggest beef that I have right now, that we've got all these numbers from a medical perspective, right? Like how many are tested, how many are infected, how many died. But we also know that the coronavirus, together with the mental health related or the fear virus, coexist, right? But we don't have any numbers for psychological related issues that maybe, once you have something that is in numbers, so when you measure something, it gets done, right? But we don't have that. Although there's a constant conversation saying that the fear in itself is probably even bigger than the virus. Majority of us don't have it, but we're panicking, we're anxious. That could even be leading to, the cause of death. It could be leading to cardiac arrest. It could be leading to, like, I don't know, more people than I've known have passed away in the past month. So yeah, I just wanted to put that out there as well. I think what doesn't get measured doesn't get done, and I think one of the biggest issues is that there's just no numbers out there that we can begin to talk about. And I don't even know how these numbers are being put together when they put it up on media, like 33%. How did you get that number? How many people did you survey? So it's the constant question of who's running the numbers and how is it being presented and what is the aim over here. So I think if we don't measure it, then what doesn't get measured doesn't get done. So
for sure.
yeah, what about one piece of advice or something that has struck you most personally in your personal life? I know, unfortunately, sometimes when we get a psych, we never talk about them as a person. We're always talking about the profession. But you're a human being. I think we've established
I
that.
think
You just have a couple of extra tools of torches. What is one advice that you received in your life that has been extremely valuable for you?
Personally relevant. Play the long game. It's sometimes I think we're just kind of we're rushing and we're trying to chase something as if this is it, and I think in the midst of that we get really tired and we burn out and we pressure ourselves a lot with usually often arbitrary deadlines for things, and just play the long game. Like, what if you had 50 years to live? Like, if you remember that, maybe if you have today to live, still you wouldn't be pushing so hard. I think you would just stop working, right? So it's either your perspective of either you have 1 day to live, what would you do differently, or you maybe have 15 days to live, what would you do differently? And I think it just kind of helped me, especially with relate. I get quite passionate and I get quite impatient, and I was like, I want change now, and but just playing the long game so that we take time to establish ourselves and we take time to actually do good work rather than just build a house of cards that will come tumbling down.
Love it. I love it. Just the other day, play the long game. That's a really super one. The other day, I had someone come in and he was telling me that let time be your friend and not your enemy. And I guess it's so much in alignment with what you're trying to say, which is we always think that that's the enemy, that we have to beat it, we have to fight it, we have to get there. But for him, what he realized is it's your friend. Stop running and fighting and chasing it. Just be friends with it. Play the long game. That's something my dad would tell me. So thanks. All right. You've been amazing. Thank you so much for doing this.
Thanks for having me here. Yeah.
Any last words that you want to say to anyone who might be listening?
Thanks for having me here, and stay safe. Yeah, all right, guys.
Be easy. Over. Thank you for all the good work you're doing as well. Yeah.
Yes. Take care.
Bye.
Bye-bye.